I'm Michael Palmer with 45 Urgent Care with your tip of the week. Now, this week I decided to start giving a talk about a condition called sciatica. And I'm planning on breaking this into actually 3 different tips of the week so we can fully explore this condition and looking at it from the standpoints of things that causes sciatica to the treatment to actually home care and how to take care of these problems. Now, first we'd like to start off just by talking about sciatica. Now, everybody that I usually see in here, will come in and tell me that at some point they might have had a diagnosis of sciatica. Well, sciatica is actually just a symptom, not so much of a direct diagnosis. Sciatica just pretty much means that we're having some form of radiating nerve pain getting down into the leg, or it could even be coming from the arm, down the arm from the neck. Now, pretty much what you have to look at on this is what is exactly the root cause of this problem. Now, sciatica can be caused from a number of different conditions. 2 in particular I wanted to talk about today is disc herniations and arthritic spinal stenosis, bone spurs. Now, both of these conditions can cause the exact identical type leg pain, but having 2 different actual causes and actually different treatments and different types of rehabilitation to help correct this problem. Now, first, I wanted to just kind of explain what disc herniations, how they work, and how they create this type of nerve impingement. Now, this looks at you pretty much from a side view. So this would be just like what your vertebrae, disc, and spinal cord look as if you were standing right here. Now, we're going to kind of look at this up close. And as you can see, the spine is made up of the vertebrae, the disc that are in between that help separate the vertebrae, and the nerve roots as they travel out through what's called a foramen. These are the nerves that I was discussing that lead coming down the legs as they come out from the low back. This gives not only motor innervation to the legs to allow you to move and function, but also the sensory aspect as well to pick up pain, heat, different types of sensation. Now, what happens with a disc is, as you can see the canal here, a disc from the front will actually bulge and get back into the canal. Now, it can come to the left, it can come wide to the right, or it can come directly straight back to the middle. Now, I'm going to flip this up on its end so you can see what it looks like. So this would be as if you were laying on your back looking down through the spine. We have the disc, we have the spinal cord. Now, like I said, the disc can bulge to the left, to the right, right back to the center, and they will all vary in degrees of the way they will create discomfort. So this is one way that we can develop the symptom of sciatica. The next one would be arthritic stenosis. Now, same model, but as you can see on this model, we have these rigid spurring effect that's happened, and it might be a little bit difficult more to see, but right actually on this portion, which is called the facet joint, which is the area that these 2 bones come together and meet, has also developed these little rigid spurs. Now, as you can see, the difference as I put these 2 spinal models together, look at the difference that's noted between the upper model as far as how big the hole is for the nerve to travel and how high the disc is compared to this model. Now, as you can see on the second model, the disc is degenerated down, and we've also developed spurring around close to the nerve. Now, what happens with arthritic stenosis is that certain movements rub that arthritis into the nerve root. So when I'm going to demonstrate actually bending backwards. So this would be someone bending to extension. When someone bends into extension, you can see they can rub that arthritis up against the nerve root and around the cord, creating these symptoms of sciatica. Now, this one model also demonstrates what a disc bulge looks like. That's what I was discussing on the previous model, but this is actually what it looks like. It's bulging out and actually contacting the nerve. Now, with this, any compressive forces going forward, going into flexion, as we're bending forward, will tend to put pressure on the disc and push it further back up against the nerve root or the cord, creating the symptoms of sciatica. Now, these are the two most common. Now, there's other things that can create these types of discomforts, but these are the two most common things that we tend to experience. Both of these, as you can see, have two different ways that a patient can present. Usually with patients with more disc problems, they will tend to have a lot of problems in the sitting position, when they're sitting down or flexing forward, creating that sciatic pain getting down their leg. And will typically have more relief when they're standing up or arching their back. That takes pressure off the disc and puts it back more on the back side of the vertebrae. Now, with patients with arthritic stenosis, these patients feel better when they're actually sitting down, because as you remember me talking about, their pain was created a little bit more from coming back into extension and the back being more erect and straight up. And for them, as they flex forward, they actually take a little bit of the pressure of the arthritis away from the nerve root, which gives them relief. Now, both of these conditions creating exactly identical type symptoms, but with two different causes, and as you'll see in my later tips, the almost identical types of different treatments that are involved in helping patients with this. Now, be sure this next week to join in as we go into a little bit more on the treatment side of how we address these two problems. And we'll get back more into how do we go about relieving this symptom of sciatica. I'm Michael Palmer with 45 Urgent Care with your tip of the week.